Hello, my name is Amani Maxalls, and today I'm going to be discussing what managerial epidemiology is, its significance, and how it has been influenced by COVID-19. In order to understand what managerial epidemiology is, we must first ask, what is epidemiology? So epidemiology is the study of the determinants of health and the distribution of diseases and injuries in specific populations. Therefore, managerial epidemiology uses the tools and principles of epidemiology to aid healthcare professionals in the decision-making process. Managerial epidemiology integrates epidemiologic practices such as disease surveillance, risk factor identification, determining patterns in disease, examining the impacts of the determinants of health, and evaluating the efficacy of treatments to enhance the quality of care, control the cost of care, advance resource allocation measures, and improve the health of populations. Furthermore, managerial epidemiologists are responsible for measuring clinical outcomes, allocating resources, monitoring demand and health service utilization, program planning, and conducting organizational strategic analyses. Although managerial epidemiology is practiced within healthcare leadership roles and is a required course in some graduate healthcare management programs, there is no national organization that promotes the practice of managerial epidemiology. So there's a clear need for stakeholder collaboration and community engagement to help integrate managerial epidemiologic practices within healthcare organizations. Next, we will discuss why managerial epidemiology is important and how it has been affected by COVID-19. Managerial epidemiology is important because it supports the development of strategic organizational goals that improve hospital efficiency, reduce the cost of care, enhance the quality of care, and improve population health outcomes. The COVID-19 pandemic has influenced the field of managerial epidemiology because healthcare leaders have had to develop policies that prevent and control the spread of COVID-19 within the workplace and in the community. Managerial epidemiologists also have had to assess the risk factors for contracting COVID-19 and evaluate how resources for disease prevention and treatments are allocated in communities most impacted by the pandemic. As a result, healthcare stakeholders have increased reporting and collaboration at the state, local, federal, and even global levels. Lastly, COVID-19 has influenced managerial epidemiology by increasing healthcare managers' utilization of evidence-based guidelines to improve health outcomes and strengthen disease prevention plans. Next, I will be discussing the issues healthcare stakeholders should keep in mind in regards to utilizing managerial epidemiologic approaches throughout emerging disease outbreaks like COVID-19. A significant issue healthcare managers should keep in mind is the potential for an organization's strategic goals and objectives to be misaligned during the pandemic. For example, if a healthcare organization is solely focused on reducing childhood obesity, it may see an increase in other morbidities and COVID-19 cases because their objectives are not representative of the population's needs. Healthcare managers will also have to develop innovative solutions to long-term issues like the shortage of healthcare workers and the inadequately trained workforce. Finally, healthcare stakeholders should be mindful of resistance to adopting population-based approaches to care. Conclusion, I will be going over managerial epidemiologic recommendations for healthcare professionals moving forward. Firstly, healthcare stakeholders should strengthen communication and coordination at the state, local, and federal levels, in addition to globally and nationally. They should also empower providers to incorporate managerial epidemiologic practices into their healthcare delivery models. Thirdly, they should utilize clinical epidemiology to guide decision-making and policy development. Fourth, they should develop evidence-based emergency response measures to emerging diseases at the organizational level in addition to within the communities. Lastly, healthcare managers should create sustainable and cost-effective intervention plans that increase access to health services and improve the quality of care. Thank you. This concludes my presentation.